All right, here's part 1 for chapter 12. This is looking at the third line of defense, which is also referred to as the adaptive immune response. This is going to be guided by what's considered the cellular response, which is T cells, and then the humoral response, which is directed by your B cells. So here's a general overview of what's occurring within the adaptive immune response. On the left, you have the cellular response, which you can see here is the T cell, and here you have the B cell. Both involve these cells interacting with the antigen, and we have talked about what an antigen is, a foreign material. With the immune system, you have an antigen-presenting cell, which has phagocytized an antigen, processed it, and will present the T cells and sometimes the B cells with a small piece of it, and then there is a very specific interaction between this antigen and this specific T cell at the T cell receptor here. So that's first stage, all right, antigen presentation. Both T cells and B cells have to be activated by their specific antigen. Once that has happened, you go through that activation process. And usually what is involved is the T cell being activated and it producing cytokines. Those cytokines are produced by the T cell but can also act in an autocrine fashion and work its way back on this T cell to cause or allow the activation to continue or to move it into what's called proliferation and differentiation. All right, proliferations increase in number, and so these cells will increase in number. You go from 1 to 3 here. Also, cytokines will go over here and activate the B cells. All right, so T cells can also physically interact with the B cell here or the cytokines. All right, these guys here, the red dots are the cytokines coming from the T cell, being internalized and causing the B cell to be activated, and in that process is going to proliferate as well, going from 1 here to 3 down here. The differentiation portion is becoming effector cells or memory cells. Both B cells and T cells can become a memory cell. We've got the memory B cell here, the memory T cell here. The effector cells are what are the type of cell that's actually going to do the work. All right, with T cells, there are multiple types of effector cells, which we'll talk about. With B cells, the effector cells are what are called plasma cells. All right, and plasma cells they look different. All right, here's your activated B cell. And once the B cell differentiates, it becomes a plasma cell. And the plasma cell looks different because its sole job is to actually produce what are called antibodies. These are proteins that are going to be secreted from the cell out into the environment. And then all of these different components are going to act together to try to eliminate the antigen. And also then, because of the memory B cells and the memory T cells, are able to then mount a quicker immune response if that same antigen from back up here comes back into the body and activates those memory cells. All right, so we've talked a little bit about T cells and B cells. The T cells are produced in the bone marrow initially, but very early in their cellular life move to the thymus to undergo maturation. And T cells have roles in both the humoral and cellular branches of adaptive immunity because of one type of T cell. And I'll talk about that once we get to the different effector cells. Right, B cells are going to be produced and mature in the bone marrow, but they also then move out into the secondary lymphoid tissues, which are the spleen and the lymph nodes, and those cells are responsible for making antibodies, and that response is referred to as the humoral immune response. Mature B cells, mature T cells are actually at relatively low levels within the blood circulation, because they mainly reside in the lymph tissues, right? Those lymph nodes primarily, some at the spleen, and then a few might actually be found in the bone marrow. They kind of migrate back, but proportionally, you're going to find most of them in the lymph nodes. All right, we've talked about antigens. All right, the antigen is any substance that, if presented in the right context, triggers an immune response. And most antigens are proteins or polysaccharides. When we're talking about an antigen to induce a response from the immune system, we're mostly talking about the bacteria, viruses, fungi, protists, got 2 spelling errors here, as well as cancer cells. And that's actually a good thing. If we have cells that are becoming cancerous in our body, we want our immune system to understand that that is a foreign cell, a dangerous cell, and try to kill it. All right, not all antigens actually induce the same type of an immune response, and immunogenicity is a term referred to as the ability to elicit an immune response. Small molecules, the example here are drugs and penicillins. These are called haptens. They're incomplete antigens, and they aren't very immunogenic, and that's a good thing. We don't want our body to react against penicillin because then you become allergic to it. There are some individuals who are allergic to drugs, but we want to avoid that. So thankfully, they're on the bottom spectrum of this immunogenicity level. All right, lipids, including LPS. Remember, that's found in gram-negative bacterial cell walls. All right, lipids are on the lower end, but that is possibly a good thing because we have a lot of lipids, and there aren't always distinguishing markers between lipids. But LPS is a very distinguishable lipid. Then you have polysaccharides. Capsules are often composed of polysaccharides, kind of those sugar groups, and then proteins. Proteins are the best type of antigen, and they're going to elicit the best immune response. Hence, they are at the top of the immunogenicity figure here. All right, now, one antigen can have many epitopes. All right, so here we have a picture of human papillomavirus. All right, and this is the molecule taken from the human papillomavirus, but each little part here that's a different color that actually represents an epitope. The epitope is the actual part, the physical part of the antigen that is recognized by the B cell and the T cell, and that little tiny antigen binding site. So with this virus, you can actually have, according to this picture, 1, 2, 3, 4, 5, 6, 7, 7. Some of these are duplicating colors, it looks like. 7 different epitopes, and sometimes that's even more. One bacteria cell, could have 50 to 100 epitopes. All right, individual spots on it that are just slightly different that the immune system can see. All right, here you have a close-up picture of T cell receptors and B cell receptors. This is where those cells are specifically going to interact with the antigen. And you have the T cell receptor here. It has this little triangle notch in it. The B cell, if this Y-shaped molecule is attached to the B cell, it is called a B cell receptor. If it is secreted from the plasma cell, it's called an antibody. Both of these are called immunoglobulins. However, if it's free-floating, it can be an antibody. If it is attached to the cell, it is a receptor. So, while a B cell receptor can be an immunoglobulin, a B cell receptor cannot be an antibody, and vice versa. Now, these receptors are antigen-specific. Right? So you've got this epitope of an antigen that binds to the antigen binding site. This is at the very end of the receptor. And likewise here, you've got the antigen binding site at the tip of the B cell receptor, One key difference between T cell receptors and B cell receptors, besides the obvious that they're on different cells, is that the B cell receptor, or the antibody here, can bind to antigens. All right, these sites here are identical. The T cell receptor only has one antigen binding site. Now, T cells. All right, looking at the type of effector cells, T cells are divided into two major types: cytotoxic T cells and helper T cells. And sometimes it's T cytotoxic, sometimes it's cytotoxic T cells. T helper cells or helper T cells. But helper T cells are noted like this, with the H, large H, subscripted. Cytotoxic T cells here. Cytotoxic, all right, cyto is cell, toxic is toxic, all right, it's going to cause a problem to that cell. T cytotoxic cells directly destroy infected cells, cancer cells. These T cells kill. Helper T cells, what do you think they do? All right, their name is a helper, so they actually help the different parts of the adaptive immune response. Oops, sorry about that. All right, they coordinate, T helper cells coordinate an adaptive immune response by stimulating other blood cells. If you recall from the original figure, T helper cells produce cytokines. Those cytokines can go to activate the cytotoxic T cells. Those cytokines can go to activate B cells. So T helper cells are kind of a bridge between all of the immune responses, and that is because of the ability for it to secrete different cytokines and different chemicals. All right, T cells have a marker on it called CD, and they have what's called CD4 and CD8. T helper cells, all right, you've got T cells as part of the cellular branch of adaptive immunity, and B cells part of the humoral branch of the immunity, and your T helper cell here being the link or the helper of both B cells and cytotoxic T cells. All right, but this CD molecule is specific for T helper cells is CD4, and cytotoxic T cells is CD8. And T helper cells are sometimes referred to as just CD4 positive T cells. Cytotoxic T cells are CD8 positive. So if someone says they have a tube or whatever, a vial of CD8 positive T cells, you should know that they are talking about cytotoxic T cells. Likewise, CD4 positive T cells, those are helper T cells. HIV infection binds to CD4 positive T cells, and in that viral process will actually kill the T helper cells, and this may take years, but HIV eventually destroys all of the CD4 positive T cells. And so what does that do? It doesn't necessarily do anything to the CD8 cells itself, the virus. The virus doesn't do anything to B cells. But unfortunately, without the help from the T helper cells, this part of the immune response can't do anything. And that's what happens with HIV patients, is their CD4 levels come down so low that they don't have the ability to mount an immune response to produce cytokines to help these guys, and they come down with different types of infections. And so for a patient to actually move from being HIV positive to being classified as having AIDS, their helper T cell count has to go below 200 parts per 200 per cubic centimeter, I don't know, a very small amount of blood, sorry, as well as they have to be diagnosed with some odd infection, right? An odd infection, an infection that they can't mount because they don't have an immune response, an immune system, but rather a disease that if you were immunocompetent, if your immune system was functioning, your body probably would be able to